in the future and the weeks after, if I ever saw that shade of pink, it would remind me, it'd be even more, it would put me back in that room.
Wow.
When we first discovered that, the remains.
I felt like I was in it too, because I think what a lot of people don't realize is, as the spouse of a firefighter, there are times where you're living what they have gone through in some way.
If you are a firefighter, or if a loved one of yours is a firefighter, I truly hope you watch this video today. Jacques and Dawn are inspirational in terms of how open they are about an event that caused post-traumatic stress disorder symptoms in Jacques. And by the end of this video, you will know what signs and symptoms of PTSD to look for, and Dawn, who is a therapist, will be giving some very good advice. If you are new to my channel, my name is Barbara Heffernan, and I am a psychotherapist who specializes in anxiety and trauma. And if you support the work that I'm doing here on this YouTube channel, please subscribe to my channel. Please give this video a like, and I'd love it if you would comment below. Let me know if you are a firefighter. Let me know if you are a loved one of a firefighter, or let me know if you have ever needed a firefighter. There have been 2 times in my life where I have needed a firefighter, and they have been right there, just right there to help in a dramatic situation. And so from the very, very bottom of my heart, if you are a firefighter, I thank you for doing the courageous work that you do. Now let's go to the interview. So I'm very excited to have with me today Jacques Roy, who is a captain at the Stamford Fire Department, and his wife, Dawn Roy, who is an LCSW and an EMDR therapist. And we are going to talk about post-traumatic stress disorder in firefighters, which is a fairly common problem. So let me ask you guys just to introduce yourselves a little bit. How long have you been with the fire department?
I'm in my 25th year of service, again in Stamford, Connecticut. We're going to discuss an incident, that led me to use EMDR. At the time that happened, I had 19 years of service.
Wow.
That experience kind of led to myself and a number of clinicians, a few other firemen, to try and make our fellow firefighters aware of EMDR and its potential benefits.
Yeah, great. You've done awesome work with that. And Dawn, you were a big part of both Jacques recognizing that he was having PTSD from that incident, if I recall, as well as forming the Trauma Recovery Network in Fairfield County. And so can you talk a little bit about the work that you do as an EMDR therapist?
Yep, so I have a small private practice in Fairfield, Connecticut, and I've been a social worker for 25 years, but I would say since probably 2011, since that time, my practice has really become much more focused on working with first responders. It wasn't something I set out to do, it just sort of naturally evolved that way. And definitely the incident that happened in 2011, from my witnessing things on a personal level with my husband, but also seeing the major gaps in adequate, accessible mental health care for first responders. Mm-hmm. It really astounded me once I started to really delve into that. And I partnered with many different EMDR clinicians in Fairfield County, and we formed this Fairfield County now trauma response team. Spent the last 8 years really doing a lot of incredible work trying to deal with that gap or the inadequate care really for first responders.
Mm-hmm. So, mm-hmm. Yeah, it's awesome. So let's go to that event in 2011. Do you want to give a little summary of the event for the viewers who aren't aware of it?
Yeah, sure. We had a multiple fatality fire in Stamford. It happened on Christmas Eve. There were 5 fatalities, 3 sisters, 3 young girls, and their grandparents. I was actually scheduled to work that morning. The fire came in about 4 a.m. I'm due in around 7 a.m., 7:30. And I reported to work. This incident was still going on. So we relieved the on-duty crews there. At that point, 2 survivors had fled the building, and they had recovered three bodies. There were still 2 people unaccounted for. And my crew was tasked with locating them. And we did. We found the grandfather and found one of the little girls. Without going into too much detail, it was very difficult. We found the grandfather, and it was evident to us that he was trying to rescue the little girl. It became a little more difficult when we found the remains of the final victim, the little girl. And just a couple of things that really stuck in my mind that caused me difficulty afterwards is we found her in a bedroom, and the room was completely gutted by fire. The best way I could describe it is colorless. Much like you would see in a fireplace, the ash and what have you in the bottom of a fireplace. That's basically what this entire room was. It was a complete lack of color. The ceiling had collapsed. There was some furniture which couldn't really make out exactly what was what, except for maybe the bed, the box springs. You could still see the springs, but the room was a complete burnout. And we were sifting through debris, and how we realized we had found this victim was we suddenly saw the color pink as we were sweeping ash away. And it was such a contrast to no color at all, and to suddenly see this whitish pink, very clear, pristine. It was such a contrast. One way I would describe it is if you've ever seen an advertisement that has a black and white picture, and then whatever's being advertised is one color, to make it really stand out. That's kind of what this was. And unfortunately, that's something that kind of got locked into my head, like that color pink. In the future and the weeks after, if I ever saw that shade of pink, it would remind me, it'd be even more, it would put me back in that room.
Wow.
When we first discovered that, the remains. EMDR talk, intrusive images, that's what I would experience. Yeah. And the other thing that really bothered me is, judging by where we found the father and found the grandfather and the girl, it was obvious to us what had happened, just knowing what we know about building construction and fire behavior, and the way the fire would travel through a room and how quickly it could happen, and just the layout. We could, the members of my crew, we could really kind of picture how this scene unfolded. And the last 10 to 15 seconds of their lives, it was pretty obvious to us what happened. So I also had kind of a mental picture or a movie, basically on how they how they perished, and that movie would play over and over in my head.
Wow.
So that's all I really want to discuss about the incident. That those, and I only mentioned those 2 specifics because that's really what I struggled with post-incident.
Sure.
Were those 2 things: the color pink and this cycle of this narrative.
Yeah. And you, at that point, had been a firefighter. You've been with Stamford, you said, for 19 years.
Yeah, I was 19 years of service.
And so what about, obviously that incident, when I still hear about it, this feels overwhelming, really. Yet I imagine you've been through some really difficult calls. What was different about that for you that led to you developing some of the symptoms of post-traumatic stress disorder?
Again, I'm not entirely sure if it was this one incident. When my wife and I first met in the profession she's in, she would often ask me, "Does anything you ever see at work bother you?" I was being honest, not really. We would see very unfortunate things, but it was nothing that would really haunt me. I think a lot of it changed once we had children, and that made me more susceptible, possibly to calls dealing with children. And unfortunately, at this time, our sons were roughly the same age as the children that perished in this fire. And in the end, that's basically what led me to seek help. Was I was having trouble feeling comfortable with my own children.
Wow.
Because quite often my anger and my fear and whatever else was affecting my relationship with them. And that was really the impetus for me to seek help.
Yeah. And I do see with clients a lot that PTSD can kick in if you went through something and then your kids hit that age, or there's some very personal connection to a situation, that makes total sense why it would hit you in a different way. And then Dawn, I know from the story that we've talked about that you were instrumental in recognizing some of the symptoms he was having and encouraging him to go for help. So what was it that you were noticing?
I definitely noticed he came home the day after Christmas. He was quiet, and just in a very somber place. But that was understandable. I felt like I was in it too, because I think what a lot of people don't realize is, as the spouse of a firefighter, there are times where you're living what they have gone through in some way. I wasn't there, obviously. I didn't see what he saw, but as much as all firefighters like to say they don't bring the job home with them, they don't talk about the stories to a lot of their spouses. Most of them will tell you that. You still bring it home. I think what's different with us is Jacques did talk to me, and that's probably because of our relationship, but also because of what I do. So there wasn't a lot of secrecy. He gave me a lot of detail. So I felt like I was really, I don't know if tolerant is the right word, but patient, both of those things in the beginning, because I knew that how could he not be affected?
Sure.
Right? But I think within a couple of weeks, as he mentioned, this anger, this irritability, kind of being withdrawn a little bit, snappy. Those were the biggest things I think I saw. I don't know if I remember much sleep dysregulation.
But you noticed those things out of the norm.
It was definitely out of the norm. And again, I kept saying to myself, you can't be too hard on him. Look what he just went through. This is a big deal, that kind of thing. But I also knew that if you don't clean a wound out quickly, it can really become infected. Right. And I was really afraid of that. So, my personality is to get in there and get it cleaned out, not to wait.
And also, doing the work that we do, we know that the sooner somebody goes for treatment for a trauma, the sooner it clears out.
Exactly.
And the post-traumatic stress disorder symptoms can go away. That it is treatable. It is, yeah.
So he did go for, he went and saw a talk therapist, with the EAP, and I remember saying, I don't think that's going to work, but, I kind of backed off because it was his decision, and I just thought, all right, you need to do your path. I have to give you some autonomy here and not be on you about it. But he went a couple times and, it was useless and it didn't do anything. And I knew because of what I know. So I just really urged him to try this thing called EMDR that I was doing and that I learned about. And so I think finally, he said, all right, I'll go, which is very classic or typical with couples, right?
Sure.
I'm going to go first, so my wife will shut up and get off my back and stop nagging me. And I didn't really care how he went. I just wanted him to get in the door.
Yeah.
Just to reiterate what Dawn said, I recognized that I was struggling.
Yeah.
And I did. I reached out through our EAP and what we had in place, thinking or hoping or expecting that it would help, and it didn't. It was that failure and me getting worse that really led to me, giving in. It was only because I was married to Dawn, who knew better, that I got the help that I needed.
Right.
Without her, who knows, where
What would have happened?
where it would have led me.
Yeah. And more therapists are becoming trauma informed, and more therapists are learning about EMDR and stuff. But that was how many years ago now? 8 years? Wow, 7 years. So I think we're making progress being more trauma informed. But definitely, if you have post-traumatic stress disorder and you go to a therapist who isn't trauma informed, it can make things either not get better or sometimes worse if you're just reliving it and reliving it.
Yeah.
So before we move on to what the treatment was like for you, which I would love to do, what would you say, like, if somebody is working as a first responder, whether it's a fireman or a police officer, EMS, what are the symptoms that would make you say this person could really benefit from some EMDR treatment?
Well, I'd probably go before the symptoms, and I would more classify it like a particular call. There's definite calls that, I don't know how you phrase it, but that can be more potent or poisonous, or I don't know what, but just more hit home, maybe more for first responders. And so if you have one of those types of calls, like if it's a suicide of your own, and that's happened, and
you mean a suicide of someone on your crew, on your job,
in your department.
In your department.
Yeah. Definitely child-related calls. I think the first responders know the difference, right? Like something that is for them run-of-the-mill isn't going to stick with them like another one. And they become very attuned to knowing the difference, right? So I guess my recommendation is if you have this kind of call, don't wait to become symptomatic, actually. It's like basic first aid. Why would you, what's the rule of thumb when your kid, skins their knee, is you get like disinfectant and you put a Band-Aid and everything. You don't wait for an infection, And that's actually happened. I've had some first responders come in that have had some pretty significant calls, and they're not even fully symptomatic yet. They may have like a little bit, and they do great because it's so cleaned out before it gets way worse. But if there are those symptoms, obvious things like how long it goes on for, sleep disturbance outside the regular sleep disturbance of a first responder, because they're always dysregulated. They're anyway. But if this is like something that you ruminate about, you can't fall asleep because you're thinking about that call or whatever it is, or you're waking up, or if you have particular dreams related to, to that call, something like that. The biggest one I hear in my office is anger and irritability.
Wow.
And that sometimes they are very good at keeping that away from the job, where people on the job would say, I would never know that guy or that woman to be angry. But at home, it unleashes. And their spouses or their kids would absolutely validate that. So, you know, the anger, the irritability, drinking alcohol, like to an increased level, you know, to numbing out, I don't want to think about this, that kind of thing.
Right.
A big one is becoming fixated or like too much into technology, like hours on social media.
Any withdrawal.
Yeah.
Numbing out behaviors. Yeah.
Exactly.
Yeah.
And sometimes it's, I don't know if it's a symptom, but it's more like a behavior. Sometimes it'll be the opposite of numbing, where they'll work obscene amount of overtime. You know, just like, I'm gonna go all the way in just so I don't stop. I don't stop moving.
Right.
The only time it shuts off is if I'm asleep.
Right.
So if I'm just gonna work. You know, other symptoms, I mean, Jacques described them, you know, the flashbacks or the intrusive images, things like that.
Yeah. Okay, great.
Increased fighting at home with family members. You know, I think a big thing I always talk about too is, are your kids all of a sudden misbehaving? That can be a huge reflection of when parents are not right. Yeah, and you know, why are they screaming at bedtime? Why don't they want to go to sleep? Why are they being disrespectful? You know,
it's
having
interesting
tantrums.
because kids will act out those emotions, and then what that also does is they take the attention away from the parent's problem, because it's very easy to focus on, oh, the kids are a problem, not me.
Exactly.
Not me being overstressed, but they're the problem, right? So yeah, that's interesting.
Yeah. So those are the things that I can think of.
Okay. It is so incredible to me how Dawn and Jacques took a pretty horrible event and then took action to address the inadequate mental health care for firefighters in Fairfield County. And by doing that, they dramatically changed the lives of many, many people. Their actions have changed how Connecticut fire departments take care of their own. So please be sure to tune in next week for the second part of my discussion with Dawn and Jacques, in which they talk about the stigma which prevents many firefighters from getting the mental health help that they need, and then also the treatment that Jacques underwent, which is called EMDR, eye movement desensitization and reprocessing. And it is a psychotherapy technique specifically designed for trauma and post-traumatic stress disorder. And I do have a few other videos on that. If you would like to watch those, I will link them at the end of this video. Links to the resources that we mentioned are listed in the notes to this video. And if you found this video helpful, please give me a thumbs up, and I look forward to the next time.